Santa Ana, California is vibrant, hardworking, and full of community pride. But like many urban areas, it's also navigating some serious health challenges, many of which have nothing to do with hospitals or doctors, and everything to do with what's around us. We're talking about the social determinants of health, the conditions that shape how we live, learn, work, and breathe.
Santa Ana made you want to bring your culture here and perform?
So, just as mentioned before, Santana is such a beautiful city in Orange County. It represents so many different cultures. It represents my culture. I'm Mexicana. I was born in Mexico. So, I definitely found a home here. I found people who were like myself, thriving, being business owners, owning things like this, and just having so much heart and so much soul, trying to help our people, just keep thriving. That's what I absolutely loved about Santana. So it's an honor to be an artist here in Santana.
A huge part of the population in Santa Ana are immigrants, many undocumented. That means limited access to public health programs and no voting power to push for better resources. Layer on top of that the language barrier. Many families speak only Spanish, and if your doctor doesn't, how do you explain that chest pain or that rash? Miscommunication leads to misdiagnosis, or even worse, no diagnosis at all.
And how is the healthcare system around here? Is it accessible, would you say?
I would say yes. If you look maybe for expensive options, they might not be available in Santa Ana.
Okay.
But in general, I believe it's okay.
What do you think we as healthcare providers could do to make your life easier?
I believe the street fairs, the presence of the big healthcare providers in the activities here in Santa Ana are important because this is a central city for the county, for the community, and it's easy to start up from here.
When it comes to access to healthy food, is it how accessible is it for you guys here? And how expensive is it?
I believe the Mexican food is much more healthy than the fast food, so it's accessible here in Santa Ana.
Okay.
So I don't believe it's any worse than the other cities. There are a lot of small merchants. I really like the street carts and the small places,
Okay. And would you say
which are not the chain or the big company.
okay? And would you say trying to buy vegetables and stuff, is that more expensive here? Where do you usually grocery shop for your vegetables and fruits?
Food for Less or
Food for less.
Albertsons or
Okay. Perfect.
Now, let's flip the coin. Despite strong education efforts, money's tight in Santa Ana. The average income? Less than half of what people make in the rest of Orange County. When choosing between rent and medical bills, guess what usually wins?
The accessible is the transportation here in city of Santa Ana.
Honestly, I think the city of Santa Ana has some good bus. If we're looking for everyday transportation, the traffic's kind of traffic is bad sometimes. One thing I have noticed working here is the parking. There's a lot of traffic right here. I see a lot of accidents, so that's probably an issue that could be worked on right here.
Okay. And I see you're working at this place. Would you say this area? How about safety? Is it safe for people to go out at night, have fun?
It's I see a lot of stuff happening. Like you might not see it so much on the main street, but on the back street, there's a lot of homeless people walking around, maybe drunk people, because this is kind of a party area. So the safety's kind of iffy. The late darker it gets, I probably feel less safe.
Okay. And how long have you been working here?
I've been here maybe about 5 years.
Okay. And in the past 5 years, would you say it's been getting safer or it's been getting worse?
I have to say it's been getting safer with the
Okay.
remodeling. They just built this new building across the street right here, and I think it's bringing new people around. It's driving away some unwanted people.
Okay.
Sure.
Do you have access to hospital in your community?
So I do have access to my hospital in the community, yeah.
Is your primary care provider, is it local? And how long does it take for you to be able to make an appointment with your primary care provider and see him?
Yeah, so it's a great question. My primary care provider is actually about like 10-15 minutes away from me.
Okay.
Unfortunately, though, oftentimes it takes like a couple months to get into schedule and see him just because of how busy the office is.
Okay. And do you find that there are obstacles in getting to see your provider besides the time? Like, for example, transportation?
So yeah, personally, I don't have any obstacles in terms of like barriers to being able to see my provider. Just the primary thing is just like the appointment time and how long it takes to get in to see him.
Okay, perfect. And do you see any community needs for additional healthcare consideration?
Do I see any community needs? Yes,
Yes.
I definitely do, especially with the increase in people that are becoming uninsured and, you know, the patients that are underinsured. I think it's very difficult for them to be able to see their provider on a regular basis, especially the ones that really need that medical treatment but aren't able to afford their copay or their deductibles. So I definitely think that there are more community needs for that,
Okay.
whether it be free clinics, things like that.
And do you think, in your opinion, because you are a resident as well, are there any programs placed for this to meet this type of needs for the community or no?
Yeah, so I mean, especially in the area that we're in right now in Santa Ana, I'm aware of a few free clinics going on, you know, within the community as well as in like different churches and stuff to try to accommodate those patients that don't have insurance. But I definitely do think we need to do a better job in creating more resources like that, whether it be food pantries, free clinics, just getting patients in even without proper health insurance.
So, what does all of this mean? It means health isn't just about hospitals, it's about clean air, a safe ride to school, enough income to afford care, and being heard. And for those entering healthcare in Santa Ana, it means understanding that true healthcare extends beyond the clinical walls. Providers must really listen, offer interpretation services, collaborate with community organizations, address economic barriers, and deliver care that respects every voice. Especially in a city where many patients are immigrants, speak languages other than English, and face systemic obstacles to receiving the care they deserve. Santa Ana is a community full of strength and potential, but also one that needs better support systems to thrive. If we're serious about health equity, we have to start with the social conditions that shape it.